Even though two types of COVID vaccines have been granted emergency use in the United States, and one of them has started to be injected to healthcare workers, a flawed distribution formula may result in those most vulnerable to the coronavirus unable to get vaccinated in time. The US has a hierarchical system for vaccination, where healthcare workers are the first in line to be inoculated, but the allocation of vaccines across states is based on the number of adults in each state, meaning healthcare workers in certain states may end up getting their doses later than those deemed lower priority in other states. The biggest loser in this flawed scheme is the nation's capital, Washington, D.C., which is able to vaccinate all of its healthcare workers only until 27.3 million doses have been distributed nationwide. Complaining about the one-size-fits-all formula, Washington, D.C. Mayor Muriel Bowser sent a letter earlier this month to leaders of Operation Warp Speed, saying the botched plan would leave the district unable to provide vaccinations to the vast majority of our healthcare workers. Operation Warp Speed is the Trump administration's public-private partnership initiative for the development and distribution of vaccines. The mayor's resentment was echoed by at least 14 states last week, according to a New York Times report. The states were frustrated that they'd got far fewer doses than expected, 40% less in the case of California, the report said. The issue at center is the scarcity of the vaccine. This is challenging no matter how you slice and dice it. There is not going to be enough vaccine in the first rounds. Lori Freeman, Chief Executive Officer of the National Association of County and City Health Officials, was quoted by USA Today as saying,